Are there side effects to using antidepressants, and what would some of those be?
Oh, there absolutely are, and many of them. Unfortunately, very often they don't show up for years because the lack of phase 4 studies.
But it's a mind drug.
It's a mind drug, but remember that drugs can have effect in all parts of the body that you didn't intend for them to have an effect.
Okay.
And so in this case, we know, for example, that among pregnant women taking an SSRI, we're talking the standard things like Lexapro and Wellbutrin and Surzone and Zoloft and Effexor and Prozac, some of those SSNRIs. But still, this kind of drug, we know that you have about a 60% increase in cardiac birth defects among those offspring. That was actually reported back in 1994 for the first time.
Really?
That was first a statement issued by the FDA in 2004. So it took them 10 years after that was knowledge that should be available to everyone before they actually made a policy statement about it. So
that pregnant women should not be taking them.
Well, I mean, if you take them, you have that risk.
Okay.
And, you know,
But
pregnant women are still encouraged to take them all the time.
They are.
Absolutely they are, because, I mean, the drug company position is this: pregnant women are more likely to get depressed. We need to prevent them from getting depressed. They may do terrible things to their children or themselves. They better be on an SSRI, even though there's these increased risks. So absolutely, it's a real concern we all need to have. Also, I would mention Surzone. Another good example. We know that these drugs cause liver damage. Surzone was so severe that the Canadian government finally said to Bristol Myers Squibb, who made that SSRI, you're going to have to take it off the market. That was 2003. Bristol Myers Squibb decided, you know, that drug is almost off patent. Let's just take it off the market in America too. They knew it was going to bring lawsuits, so they voluntarily took it off right before patent was expired anyway, so it wasn't really a big deal. But anyway, so we keep finding that there are harmful side effects. It takes years very often because the drug companies who are supposed to do the research, the phase 4 studies, to find out what the harmful side effects are, they don't do those studies or don't do all the studies that are required.
And they can get by with it.
They can get by with that, unfortunately. The FDA does not enforce the law here. We also know that these drugs can cause movement disorders, tardive dyskinesia being one. We know that these drugs can cause tooth decay. We know that you have about a 21% increased risk of tooth decay any given month, any given year as a result of being on these drugs. It also leads to tissue damage in the mouth. It leads to sleep disorder. It leads to constipation, you know, sexual dysfunction. There's just lots of problems associated with these drugs that people need to know before they are taking these drugs.
Thank you very much.
You're welcome.